The American Brain Tumor Association is pleased to welcome you to our patient and family meeting 3-day series, Brain Metastases, Life After Diagnosis. My name is Emily Lippert, Senior Program Manager here at the American Brain Tumor Association. As the leader of brain tumor education, support services, and research, the ABTA created the Metastatic Brain Tumor Collaborative to inform, support, and empower patients diagnosed with a metastatic brain tumor. Thank you to our collaborators for their partnership of this meeting series. Additionally, thank you to ABTA sponsor, Accuray, for their support of this meeting. We hope each of you enjoyed the last 2 days of sessions. If you were not able to attend live, the recording will be available in the next few days. Today, we have another excellent topic and speakers. Day 3 of our Brain Metastases meeting will focus on the emotional journey of brain metastases. Being diagnosed with a brain metastases often results in increased distress due to already being diagnosed with a primary cancer. Attendees will explore common areas of distress, discover methods to enhance emotional well-being, and learn ways to extend quality of life. Our speaker today is Betsy Fricklas, who is a physician assistant specializing in palliative care at Duke Health. Betsy is dedicated to improving the quality of life for the individuals facing serious illnesses. As the director of palliative care at the Duke Center for Brain and Spine Metastases, she provides compassionate guidance to patients and families navigating complex medical journeys, while cultivating a supportive and empathetic environment for all. Joining Betsy is her patient Jakarta, who will share her perspective on the emotional journey of brain metastases. Thank you both so much for joining us, and Betsy, you are welcome to begin your presentation.
All right, can you see that okay?
I can, you're doing great.
Excellent. All right, well, good afternoon, everyone. It's truly an honor to be part of this ABTA webinar series. As Emily shared, today we'll be exploring the emotional journey of living with a diagnosis of brain metastasis. Our time together today is meant to really offer support, insight, and practical strategies to help you care for your emotional well-being. We'll talk about the importance of compassionate whole person care that addresses not just the medical, but also the emotional, psychological, and social aspects of your experience and quality of life. Most importantly, we hope to leave you feeling a bit more grounded, supported, and empowered as you continue on this journey with hope and resilience. I have no disclosures to share. And as Emily shared, our objectives today are to explore the common areas of distress, discuss ways to enhance emotional well-being, and to focus on extending quality of life. I thought we'd begin by understanding brain metastasis with a description of what it is. So, as was shared with previous sessions earlier this week, you may have learned that brain metastasis happen when cancer cells spread from their original location to the brain. This can happen with various types of cancer, including lung, breast, and melanoma. Brain metastases are the most common type of brain tumor in adults, far outweighing primary brain tumors. With advancements in cancer treatments, many are living longer, which paradoxically has led to an increase in the prevalence of brain metastasis. It is estimated that 10 to 30% of adults with cancer will develop brain metastasis. Thus, it's essential to focus not only on the physical symptoms, but also on the emotional and psychological impacts of such a diagnosis. So let's explore the common areas of distress. These fall into 3 domains: emotional, physical, and social. These areas are interconnected, meaning that distress in one area can affect the others. Understanding these connections can help you and your support network address your needs more holistically. So hearing the words brain metastasis can be life-altering. It's completely normal to feel shocked, scared, numb, or overwhelmed. You may find yourself asking, why me, or what now? I had a patient last week who shared with me, I went kind of numb. I'm scared. I don't know what this means. Am I going to die? My mind is thinking thousands of outcomes. I'm terrified. This pain is a constant reminder of the cancer. There's really no one right way to respond to a diagnosis like this. I think it's important to give yourself permission to feel whatever comes up. Taking things one step at a time and focusing on what's known today can help you feel more grounded in the face of uncertainty. The emotional toll of brain mets can be as equally profound as the physical impact and often less visible. Many individuals experience a wide range of emotions, from anxiety and sadness to anger and guilt. These feelings are completely natural and valid as you adjust to the many changes and uncertainties that come with this diagnosis. Anxiety may arise from uncertainty about the future, fear about how symptoms will affect daily life. And depression can stem from feelings of loss of independence, of roles and routines, or of the life that you had imagined. Grief may come not only from what has changed physically, but also from the emotional and identity shifts that occur when facing a serious diagnosis. It's also common to feel isolated, even when surrounded by loved ones, because others might not fully understand what you're going through. You might feel frustrated by the changes to your body or mind, or guilty about the emotional impact your illness has had on your family and friends. Recognizing and naming these emotions is a powerful first step towards coping with them. These feelings are not signs of weakness, they're human, and you do not have to carry them alone. Brain metastasis can also bring a wide range of physical symptoms, which can vary based on the number, size, and location of the tumors in the brain. Common symptoms include headaches, fatigue, weakness, balance problems, seizures, vision changes, and cognitive challenges, such as memory loss, confusion, or trouble concentrating. These changes can make everyday tasks like reading, cooking, working, or even holding a conversation feel more difficult or frustrating. You may notice shifts in how your body feels or moves, or in how your body processes information. It's not unusual to grieve the loss of physical abilities or routines. These physical changes can impact your sense of independence and identity. A diagnosis of brain metastasis impacts not only you, but also your entire support system. Each family member and friend might respond differently. Some may withdraw, while others might be intensely involved. I think it's crucial to have those open conversations about your needs and boundaries to navigate these challenging dynamics effectively. Acknowledge the life and roles have changed for caregivers too. They can experience significant stress, exhaustion, and emotional turmoil. Remind them that prioritizing their own well-being is not selfish. It really is essential for maintaining their ability to provide care effectively. By caring for themselves, caregivers can continue to offer the support and strength you both need on this journey. I like to use the analogy of like when you're on an airplane, right? Like when the oxygen tank comes down, you need to put your mask on first before helping others. And I think that, pertains to helping that loved one navigate this journey. Next, we'll focus on enhancing well-being. So enhancing your emotional well-being is really essential to building resilience, nurturing hope, and improving your quality of life throughout cancer treatment. I think many people mistakenly think that coping with cancer simply means enduring it, whether you like it or not. But in reality, coping is about finding ways to adapt to the diagnosis. While you can't change the fact that you or a loved one has cancer, you do have the power to manage your response and navigate life with cancer in a way that supports your well-being. Coping with brain metastasis is a deeply personal process. There's no one-size-fits-all solution. What brings comfort and relief to one person might not resonate with another. That's why it's important to explore a variety of tools and approaches to see what supports your emotional well-being and fits into your daily life. Some people find grounding in mindfulness practices. This is a self-directed technique where you imagine a positive or calming scene, such as being on the beach. I've attached a QR code here from the American Cancer Society to see an example of what a mindfulness practice may look like. Other techniques like deep breathing, meditation, or gentle yoga can also be helpful in quiet those racing thoughts and easing anxiety and bringing a sense of calm to moments of overwhelm. Creative and expressive therapies such as journaling, music, art, or dance can offer a powerful outfit for emotions that may be difficult to put into words. These practices can foster a sense of expression, identity, and connection, even in times of uncertainty. Distraction is another coping tool that may include spending time in nature, reading, or simply engaging in small rituals that bring you peace and comfort. It's okay if some days are harder than others, and it's okay to ask for help if you need it. Coping isn't about being strong all the time. It's about finding what helps you feel supported, grounded, and more like yourself in the moment. A strong support network, whether made up of family, friends, healthcare providers, or others living with similar experiences, can be one of the most powerful tools in coping with this diagnosis. Being connected doesn't always mean talking about your illness. Sometimes it's just sharing a laugh. Humor can be, a really important and effective coping mechanism. Or sitting in silence, watching a movie together, or just being in the presence of someone who cares. Your support network doesn't have to be big. Even one or two people you can lean on can be enough. The goal is to feel seen, heard, and held, especially on the hardest days. And remember, support is a two-way street. While others help you, they may also be inspired by your strength, honesty, and grace. No one should face this journey alone. The importance of effective communication is key. With your loved ones, we know that effective communication promotes understanding and support. Sharing your needs and emotions helps your loved ones understand what to offer in regards to the right kind of support. Are you one that wants companionship or space? Communication sets realistic expectations. It clarifies your limitations and capabilities, helping others adjust their expectations. Some folks have more energy in the morning or in the afternoon, for walks or a visit. So it's important to communicate that. It also strengthens relationships. We know that vulnerability fosters trust, deepening emotional connections with those who care about you. And it reduces feelings of isolation. Honest communication helps others better understand your experience, making you feel less alone. Open communication is also really important with your healthcare team. I always encourage my patients to write down like those top 3 questions ahead of time, so they can ensure that their concerns are addressed during that appointment time. Gaining a thorough understanding of your diagnosis and the options really empowers that informed decision making. Ask about the side effects. Understand how, treatment or diagnosis may impact your daily living and well-being. Communicating your values and priorities ensures that your care plan aligns with your personal wishes. We want to know what matters most to you, so we can ensure that that care plan aligns with that. And finally, recognizing the expertise of various specialists ensures that comprehensive and coordinated care. Oftentimes care for folks with brain metastasis includes not only like medical oncologists, but also the radiation oncologists, neurosurgeons, palliative care team, maybe a nurse navigator, social worker, therapist. Again, like we all play a different role in your care. And we want to work together to provide that very best care. So I also want to highlight the importance of the interdisciplinary team, starting with therapists who provide that supportive counseling. Many patients of mine, they have difficulty sleeping because it's hard to, shut off your mind from those racing thoughts at night. And so the therapist can help talk about some of the adaptive coping strategies, in that realm. Psychiatrists can assess and treat mental health conditions, offering medication management and therapeutic interventions. Spiritual care providers offer that guidance, comfort, and a listening ear, addressing spiritual concerns or existential questions during treatment. I rely a lot on my child and adolescent life specialist. A lot of the patients I care for are parents or grandparents. And the role of a child and adolescent life specialist is to really help families give age appropriate, verbiage to share the news of a cancer diagnosis, with their child or grandchild. They also can meet with kids and help answer those questions, and help them learn about some expected changes in their routines that may happen when their loved one is undergoing cancer treatment. Many of my patients have the goal of improving mobility or function or independence, and that's where physical and occupational therapists can come in. They really manage those physical symptoms or side effects of treatment and can, give some recommendations for assistive devices. I had a patient who was suffering from chemo-induced peripheral neuropathy who loved to fish, but wasn't able to like thread a fishing hook. And so the occupational therapist, gave a suggestion for a device or an apparatus to help thread that hook to allow him to continue to do that. Social workers are also super important. They help with the emotional, social, and practical challenges, connecting you with resources and support networks. And finally, financial care counselors. They help navigate insurance, billing, and financial planning, really reducing the stress about the costs of treatment. The mind-body connection is really powerful. Physical activities and good nutrition can positively influence your emotional health. There are many benefits of nutrition. It can boost energy levels. Cancer treatments like chemotherapy and radiation can lead to fatigue, but a healthy diet can improve the energy needed to sustain daily activities. Good nutrition can also help maintain strength. Eating the right balance of protein, healthy fats, and carbohydrates helps preserve muscle mass and overall body strength during treatment. Nutrition also helps manage symptoms. We know that a well-balanced diet can help mitigate side effects like nausea, appetite loss, and digestive issues caused by cancer treatment. Physical activity, like through exercise, is also very beneficial. Exercise can help maintain strength, flexibility, and stamina, which is really essential for daily living and helps combat treatment-related fatigue. Exercise also helps reduce stress and anxiety. We know that physical activity triggers a release of endorphins, which is the body's natural mood enhancers, helping to manage stress, anxiety, and depression. It also helps improve sleep quality, which are often disrupted during cancer treatment, aiding in overall recovery. Like so many of folks I take care for, struggle with sleep. So adapting to life with brain metastasis means creating routines, whether that's setting a regular bedtime or wake up time, or maybe a time, for a social visit or a walk. It's also important to prioritize that self-care, such as taking a hot bath or resting or reading. I encourage my patients to set small, daily achievable goals. So a lot of folks I care for, maybe once we're running marathons or walking 5 miles a day, and maybe that's not possible anymore. But I think setting a goal like walking to the mailbox and back each day or spending 30 minutes, sitting on the porch, something that they can do, that they can check off, I think is really important. And finally, asking for help. I think it's common to worry about being a burden or not knowing how to express your needs, but asking for help is really a sign of strength, not a weakness. I think your loved ones and friends really want to help, but might not know how. So sharing specific ways that they can assist, whether, by running errands, attending appointments, or simply being a companion, can make a significant difference in your well-being. So finally, extending quality of life. It's about really focusing on what truly matters to you, finding joy in everyday moments, and setting meaningful personal goals. It's important to remember that enhancing quality of life doesn't mean ignoring the challenges, but rather finding ways to live fully despite them. This is where palliative care plays a crucial role. I think many folks have not heard of palliative care, or there's just a misperception in the public of what it is. So I just wanted to start with that definition that palliative care is specialized medical care aimed at providing relief from the symptoms and stress of a serious illness like brain metastasis. It focuses on improving quality of life for both you and your family by addressing physical symptoms, supporting emotional needs, and helping navigate complex medical decisions. It's appropriate at any age and stage in a serious illness and can be provided along with curative treatment. So as Emily shared in my introduction, I am part of the multidisciplinary team of neurosurgeons, radiation oncologists, and medical oncologists. And we offer a palliative care appointment at the very initial visit, to Duke. Learning that integration of early palliative care is very important. Incorporating palliative care early in your treatment really enhances quality of life by managing symptoms such as pain or fatigue, allowing you to engage in activities that bring you joy. Palliative care teams offer compassionate communication and a safe space for you to express fears and hope. We also aid in bridging the gap of communication with your larger team. recognize there's a lot of key players who are caring for you. For caregivers, palliative care provides that guidance and emotional support, helping them cope with the demands of caregiving. And finally, the palliative care team works with you to align your treatment with your personal values and goals. That may be quality or quantity of time or function or being present at certain important milestones of life, ensuring that your care plan reflects what is most important to you. We are available in multiple settings. Again, we see folks in the outpatient or clinic setting. We also have teams available for folks who are hospitalized on the inpatient side. We provide home-based palliative care for folks who have a hard time coming to clinic or maybe don't have video capability. And we also provide care for, skilled nursing facilities or in rehab institutions. I wanted to highlight a really powerful study that was done by Dr. Jennifer Temmel at MGH in 2010. This is a study looking at folks with metastatic non-small cell lung cancer, and it showed that early palliative care led to significant improvements in quality of life as well as mood. Folks with early palliative care had lower rates of depression and anxiety. They also had improved symptom management, what led to overall well-being. And finally, which was very surprising, that patients receiving early palliative care had less aggressive care at the end of life, but longer survival. I think even in the hardest moments, it's really important to find peace. Finding that inner peace promotes emotional resilience, helping you build the emotional strength needed to cope with the challenges of cancer. It can help reduce the stress, uncertainty, and fear that often comes with diagnosis and treatment, empowering you to face each day with more strength. Fosters emotional well-being. So accepting the emotional journey of cancer allows you to let go of that fear, anger, or resentment. Instead, you can focus on maintaining hope, acceptance, and emotional balance, which fosters a sense of peace and well-being. Peace improves quality of life. When you can find peace within yourself, you can experience that better quality of life. It allows you to feel more present in the moment, stay connected to your loved ones, and stay grounded in your personal values and sense of purpose. It supports coping with uncertainty. Cancer often brings uncertainty about the future, but finding peace helps you live in the present. It enables you to manage the unpredictability of your diagnosis and treatment with a greater sense of calm and clarity. And finally, it encourages you to reflect on personal values and legacy. Taking time to reflect on your personal values, the impact that you want to have on others, and the legacy you wish to leave behind can provide that sense of peace and purpose. It helps you focus on what truly matters, bringing clarity and fulfillment as you navigate your cancer journey. For many, faith and spirituality provides comfort, strength, and a sense of peace. However, I think it's natural to have those spiritual questions during challenging times. Like, why me? Why now? Like, I lived a good life. Open conversations with chaplains, faith leaders, or trusted individuals can offer that guidance, support, and reassurance. And for those who don't identify with religious beliefs, finding meaning through nature, art, or personal values can also be deeply comforting. Reflecting on what truly matters beyond just treatment can bring a sense of purpose and inner strength. And finally, the power of hope. Hope is often thought of in terms of a cure, but it's also so much more than that. It's about celebrating good days, finding joy in meaningful moments, and embracing what brings you peace. Each person's hope looks different, shaped by personal experiences, values, and circumstances. It's important to remember that hope isn't a one-size-fits-all concept. What gives hope to one person may not be the same for another. That's why it's so powerful to redefine hope in a way that feels true to you, focusing on what matters most in your life, whether that's time with loved ones, pursuing personal passions, or simply finding comfort in the present moment. By redefining hope, we empower ourselves to find strength and resilience. So I think some of the key takeaways today that are that emotions will fluctuate. It's natural for emotions to ebb and flow throughout this journey. Some days may feel overwhelming, while others may bring a sense of peace or clarity. Be gentle with yourself. Celebrate those small wins and know that you have the right to seek joy, comfort, and meaning no matter where you are. You are not alone. There is strength, support, and hope in this journey. Whether it's through loved ones, healthcare teams, or community resources, support is always available. Lean into the networks around you and give yourself permission to ask for help when needed. I wanted to leave you with a few resources, starting with those for patients. ABTA, with the QR code here, has a number of amazing resources, starting with the Care Line, which is a 1-800 number that's staffed during business hours that provides information on treatment and care, finding, brain metastasis treatment centers, financial assistance resources, and help with finding clinical trials. It also offers support groups, both in person and virtually, and webinars. The American Cancer Society is also an amazing resource, from educational material and support, as well as resources like lodging during treatment, rides to treatment, and a 24/7 helpline. And then Get Palliative Care. This provides information about palliative care and shares patient stories and has a FAQ section, like to let you know, is it right for you or how to get it? Several mobile apps I wanted to highlight. One is MediSafe, which helps manage medications, acknowledging that lots of folks with brain metastasis are on a number of medications, and also helps organize appointments. Headspace offers mindfulness and meditation exercises, and Calm, there is a free piece to that offers some guided meditations, sleep stories, and relaxing music. I think explore your community resources, so support groups that are offered maybe through your medical institution or some educational workshops. I know at Duke, we have a Duke Cancer Patient Support Program that offers a calendar of events each month. And each day there's a new workshop. Some are on like seated yoga or Tai Chi or caregiver support. There are even disease-specific support groups that you can tap into. And finally, the book called The Cancer Survivor's Companion by Dr. Frances Goodhart and Lucy Atkins that really provides practical advice and emotional support for individuals living with cancer, focusing on helping people navigate the physical, psychological, and social challenges they face with the diagnosis, with tools to enhance well-being. For families, family counseling can be super helpful, helping to navigate those emotional challenges of cancer care, offering guidance on communication, coping strategies, and overall family well-being. Again, ABTA has some wonderful resources, including a support group locator where you can find local or virtual support groups that connect you with others facing similar challenges, and a mentor support that's available to both patients and caregivers, where individuals can connect with experienced mentors for personalized emotional support. The cancer support community offers a wide range of support services, again, including emotional support, educational programs, and community resources for family. And then some educational materials to point you to, again, through ABTA are that Caregiver Resource Center and Caregiver Handbook. And then some online forums, excuse me, include Connections, which is a virtual platform where caregivers, survivors, and patients can connect, share experiences, and offer support. I know oftentimes sharing updates of your loved one with family and friends can be taxing. It's hard to respond to all text messages and phone calls. And so CaringBridge can be a really great free online tool to help those families create personal websites to share those updates, gather support and communicate with your loved ones. I also wanted to share a digital platform that was created by one of my neurosurgery colleagues. I was part of a panel that presented on a complex case of a patient with brain metastasis at neurosurgery grand rounds. And afterwards, a neurosurgeon I hadn't yet met connected with me and talked about how he was touched by palliative care's role in creating legacy for patients living with advanced illness. And so he created this site called Embrace, which allows loved ones to create a video montage to really celebrate, motivate, or comfort a loved one in the moments that mattered most. So there is the first Embrace is free, and it is like a 30 or 60, 30 to 60 second video that family and friends can record that they will stream together, and they will share with that loved one at a designated date. So I encourage you to look into this. I also wanted to share that ABTA has partnered with the following organizations who have resources dependent on patients' primary cancer. And I really want to thank you for being here and for allowing me to be part of this presentation. And then I want to introduce my wonderful friend and patient, Jakarta, who is a survivor and thriver since her initial breast cancer diagnosis in 2009. She is a social worker, wife, and person of faith who's truly lived life to its fullest. And I'm so grateful that she is here with us today. So I'm going to stop sharing my screen and have her join us today. And again, Jakarta, I was hopeful that maybe you could share a bit about your journey with your brain mets diagnosis with the group.
Okay. Well, in 2009, I was diagnosed with triple negative breast cancer. And if you know anything about triple negative breast cancer, it's a really aggressive cancer. And it's mostly common in women of color. So, and of course, that diagnosis in itself was extremely scary. But I do have family history, so it was not a shock when I was initially diagnosed. But then in 2019, I was diagnosed with the brain metastasis. And honestly, I was quite numb. I was shocked. I was angry. I was scared. I mean, I thought I was going to die. I entertained all those emotions that Betsy had previously talked about. I think I went through all of that. With the brain metastasis, the stage changed. I went to stage 4, and that, a lot of people think at stage 4 it's the end. But as you all can see, I am still very present and I'm still here. And I am very thankful for that. And I'm just happy to be here with you today to just kind of share about my journey and what has pretty much helped me through this difficult process.
Thank you so much. What would you say are some physical or emotional challenges that you've experienced since your diagnosis, and what kind of coping mechanisms or strategies have helped you manage them?
Physically, I think a lot has changed with me. I mean, I've dealt with headaches, and I'm sure that's from the different brain metastases, because I had actually 2 brain metastases. So I had 2 different brain surgeries. So there's been, headaches that I get from time to time. I've actually had 1 seizure that I don't remember a lot, but a lot of my family, they have told me different things about the seizure, but I've had 1 seizure. I've actually also had a stroke. Headaches, that is something that has been kind of ongoing throughout this diagnosis. As far as cognitively, the way that I process it is very different. It's very different than the way that I used to process. I have to allow myself grace and, just understand that I've been through a lot and, things have changed differently. So as far as coping, I pray a lot. I cry a lot, and I'm not afraid to say that. Crying is a sense of release for me, and I have no shame in that at all. But the way that I process things it has changed significantly. I am not, I don't, sometimes I don't feel the same person that I used to be. And to be honest and to be very transparent, and I'm not, because a lot has changed cognitively. But the thing about me is that I am determined, and I don't give up easily, and I will continue to fight and see this diagnosis through. So, but those are definitely things that help me.
Yeah, thank you for that. I see you as, such a resilient person. We met in 2019, so we've known each other for 6 years,
Yep.
which has been really incredible, like to have that relationship and that, rapport and trust, I guess.
Mhm.
What role would, you touched a bit on your faith, and maybe you can expand on that a little bit more, but, what role have your loved ones and again, your faith played in your experience?
I would just say that my faith in God has definitely kept me sane. Um, He is my ultimate source, and I trust Him completely with the life that He has given me. And I know that it's because of God that I am sitting here today, and I'm actually able to participate in this conversation. As far as my family, um, my family, they love on me. We are a family of faith. My whole entire family, we're both sides of my family. We are a family of faith, and so we do a lot of praying. We do a lot of believing, and we trust God. And I am blessed to have a very, very supportive family. I have an amazing husband who has walked with me through this entire process. And I get a little emotional about that because I just feel so blessed to have been blessed with him, because he not only has been with me through this process, but he has also lived through this process with me. The ups and downs, it's been as equally difficult for him, I think, as well. So, but the good thing about it is that we walk and we believe together. And and that's a blessing. And, I apologize well, actually, I don't apologize for the tears, because, it's real. This is real. This really, really is what life is right now. But, we're grateful. And, I don't look like anything that I've been through, and I've been through a lot, but I'm just so happy that God is keeping me here for a reason. And slowly by slowly, that's being revealed to me. But like I said, I have to trust God through this. And like I said, He is literally keeping me sane, because I really could have lost my mind with everything that I've been through and all of the emotions, but I've never felt like giving up. And that's one thing that I'm eternally grateful for.
Thank you for sharing that.
Mhm.
I have to share too that like I've gotten to know Eric over these past 6 years, your husband, and I love, he comes with you to all of your appointments, when you
Everyone.
drive an hour and a half to come to Durham.
Yeah.
And I love that, it's never easy to come to your appointments, right? It's a
Okay.
traffic, it's parking, it's like waiting
Yes.
for all of us to see you. But you always
Yes.
make a fun day out of it, that you look forward to finding a fun restaurant, in the area to enjoy
Yes.
together. And so you always find that positive, and that's something I just think so highly of you about. Yeah.
Thank you. Thank you.
You know,
I
as healthcare providers, I think one thing that we strive for is to like, communicate well with each other, but like also with you and your loved ones. What would you say your experience with your healthcare care team has been in terms of that communication and support?
I am so grateful for my medical team. Each and every one of you. I feel like I have a different relationship with all of you, but I am so grateful for my medical team. I enjoy the fact that you all not only hear me, but you listen. And that's really important to me as a patient, is that I am able to be Jakarta. I'm able to express myself, my good days, my bad days, when I'm angry, when I'm sad, when I don't understand, you all are, you're very, very patient. But I know that I am blessed with the medical team that I have, and each one of you are very, very special to me. And like I said, I feel like I'm able to talk to you about anything. And one thing about my medical team that I do respect is that you all don't mind me asking questions when I don't understand. I mean, even if I had to ask it repeatedly, and I know, Betsy, the relationship that you and I have is just kind of like, when I say, okay, Betsy, can you repeat that to me one more time? And you say, Jakarta, I'll say it as many times as you need me to say it. And I just love that. I love that about you. But I mean, my medical team is amazing. And I'm so grateful. I really am.
I think again, our goal is to make you feel like heard and understood. And I love that you're feeling that. I think another story I just wanted to share, with the group here is that we have pet therapy as part of our team in the clinic setting. And Jakarta had shared with me that she'd always wanted a dog, and she wanted a different size dog than maybe Eric wanted, but they could never really agree on it, and she never was able to get the dog. But we had pet therapy come one day when she was visiting me with me, and she went out to the waiting room, and I forgot the dog's name, but like you were like so happy to be with that dog.
I
I
was so
captured that
happy. I
picture.
did it because it was a
Yeah.
big dog.
Um,
Yes.
yeah, so that was really incredible. And then I think, as part of that, we had talked, and you're a social worker yourself, you
Mhm.
recognize the importance of like that supportive counseling. We talked about kind of getting therapy, involved in your care, and I had made that referral. And then you had asked me that, you would really feel more comfortable like talking to another person of color. Would you like expand on
Right.
that a little bit?
Yes, definitely. Initially I did have some reservation about that because I didn't want to offend anyone, but I felt that, with the relationship that I have with you, that I was able to make that request to you, and that you would, would not be offended, that you would, not take it personal at all. But I just felt like, just being a Black woman and wanting to speak to a Black therapist, I felt like they would be able to really identify, with some of the, the daily issues or challenges that I may face. And it probably would be more understood since it's part of my community. So that was my reasoning for wanting to speak to a Black therapist, because, I'm sure they're different emotions are handled differently, with races, within different races. But I just felt like, being a Black woman, I just felt like another Black woman would probably understand, a lot of what I'm dealing with or where I'm coming from.
Yeah, I very much appreciate that honesty and that trust that you had with me to like make that request. And I'm glad that was a match.
Mm-hmm.
In my presentation, I talked a little bit about like hope and how that can mean different things to different people, and how it can mean, things beyond just a cure. What does hope mean to you throughout this journey?
Hope for me is comfort. It's comfort for me, and it's an emotion, it encourages me to continue to keep fighting this illness, because as you mentioned, in your slides, and I was actually getting a little emotional during your slides, because I mean, it's it is a serious illness. When somebody is, going inside your head, and things change and things are different. But hope is it's just an emotion that I hold on to, and it's something that that allows me to continue to want to fight.
Awesome. Yeah, I appreciate that. And then I would just ask a question. You came to me for palliative care back in 2019 as part of
Mm.
kind of the larger team, and I think you came to me in part for like pain management. Can you tell me, maybe share with the group a little bit about like what you felt when you were advised to have palliative care as part of your team, and how that experience has been?
Yes. Well, initially when I came to you, for palliative, when I was referred to you for palliative care, I was a little concerned. I mean, to be honest, Betsy, and I think it was because I did not understand. I thought palliative care was like, okay, am I going into hospice? I mean, is this what this means?
Mhm.
And I'm like, okay, is this the end? Is this the end of my life? But I've just learned so much that it's so much bigger than that, and that is not at all not at all what it means. But I was really concerned initially when I found out I was being referred to palliative care, because I knew that my stage, had changed to 4, and so I was like, okay, I don't understand this. Does this mean I have to go to hospice? And I mean, you were very, very, very comforting to me, and you gave me that hope. There's that word, but you
Mhm.
gave me that hope, to know that it's palliative care is a lot bigger than, and often misunderstood as to what people think that it is.
Yeah, thank you for sharing that. I think that
Yeah.
your thought is very similar to many folks who, come
Mhm.
to us in clinic, that a lot of folks equate us with end of life care. When in reality, we really, with the NCCN guidelines, we really are trying to get involved at time of diagnosis to be that extra layer
Right.
of care and support and make sure that the care that we provide is in line with your goals and treatment preferences. So
Exactly.
thank you for sharing that piece. And then my final question for you would be, what advice would you give to others with newly diagnosed brain metastasis?
Utilize your resources. Definitely talk to your medical team. Give yourself some grace, because it is life changing. It definitely is life changing. So just give yourself grace. Ask lots of questions. If you don't understand, it's okay. It's okay if you don't understand, but just give yourself grace and just be patient with yourself. This is a life-changing diagnosis. So, I mean, just ask lots of questions. Definitely keep positive people around you, because you really need to stay focused and be positive. You really don't have time for, negativity, drama, in any of that. So those will be my biggest pieces of advice for you. But definitely you utilize your resources. There are so many resources out there that I didn't even know about. But through my medical team, I was able to get connected. And definitely don't be afraid to engage in therapy, because therapy is something that is necessary, to basically help you gauge through a life-changing diagnosis such as this.
Thank you so much.
You're welcome.
Do we want to open this up to questions, Emily?
Yes, I want to open it up for questions, but before we do so, I just want to say thank you so much, Betsy, for such an excellent presentation. And thank you so much, Jakarta, for your willingness to share a bit about your experience and being willing to be vulnerable and open to share with all of us today. So yes, we do have a few questions coming in, but for those of you who have not submitted a question yet, feel free to click on the Q&A button in your Zoom control panel, and we will answer questions as time allows. Feel free to ask questions to Betsy or Jakarta, and we will get them rolling here in just a minute. Okay, so before we get to that, I just want to say, Jakarta, we have some great feedback coming in the Q&A. People just saying that they are, going alongside you and will be praying with you.
Oh,
And
thank you so much.
yeah, and they're just saying that thank you so much for sharing your testimony. Also, we have a few other comments here saying that you and your husband are such an inspiration and that they're really proud of you for sharing your experience today.
Thank you. Thank you so much.
Well, you just touched a bit on it, but I want to kick off this Q&A with this first question of somebody asking, what are the key differences between palliative care and hospice care? Like, how can we debunk that myth that palliative care is at the end of life? Like, how can we clarify to patients that it's necessary in the beginning stages of treatment?
Yeah, that's a great question. So again, palliative care can be provided at any age or stage of a serious illness. So although again, my area of interest and expertise is in for folks who have brain or spine metastasis. Our team also sees folks who have, early stage cancers who are going through very toxic treatments with curative intent, with the purpose of providing that symptom directed care to help them live as well as possible. And so again, our team is comprised of typically a nurse navigator, a social worker. We have spiritual support as part of our care team as well, to not only support you, but your whole family as you go through treatment. Acknowledging that there's times when you need us more and times when you need us less, depending on, treatment toxicities and such. So I think of palliative care as a large circle, with hospice being a small circle in that. So all of hospice care is palliative, and some of palliative care can be hospice. So again, we can refer folks to hospice who have opted not to pursue further cancer-directed therapy and who may have a life expectancy of 6 months or less. We can talk about that and make that referral, but we are separate entities.
Mhm.
Thank you so much for explaining that. All right. Oh man, we're getting so many great questions. Okay, so next question here is, I have cognitive issues. And this person is curious when you knew Jakarta, when it was time to go back to work. And did your employer accept the new you?
Actually, I did not return to work. I actually had to come out of work because of the job that I did. I was a child protective services social worker for 17 years. So that level of processing, you have to make, emergency decisions and be quick in your decision making. And I knew, considering the diagnosis that I was giving, I had to be very, very, very transparent and open with the fact that I could not return to work. And that was something that was very, very emotional for me, because I loved the job that I used to do. So, it was, but I realize now that, I'm still a social worker. I may not be physically in the office, but, I will always be a social worker. That's a title that I'll always have.
Well, I commend you for being willing to assess like how you were doing and make that decision to not to return to work.
Yeah.
So I ask you, Betsy, if you can kind of chime in on this question. So the person asking this question has a concern, that they won't be able to return to work. Like, what tips could you maybe give them that they want to return, and but how can they evaluate if they are willing to do so or not?
I think that's a very personal choice. I think depending on what your work is, sometimes, jobs allow you coming back in, modified schedule. And so I have a lot of folks that, again, their job brings them, joy and meaning in their life. It's a good distraction. And so sometimes they go back part-time. And, we would support that. I think for those who aren't able to physically or mentally go back to a job, I think is, again, finding something else that's meaningful that they can contribute to. I have another patient with metastatic breast cancer who today just shared with me that she's joined our Duke Cancer Patient Advisory Council. So again, she's kind of sharing her story and helping us as a larger institution develop more resources and supports for our patients who are living with cancer. So I think finding that, setting those small goals and finding that meaning in what you do.
Great, thank you. Next question we have is, do you have any good book recommendations for caregivers who are helping their loved one during this journey?
Yeah, I think that's a great question. I think caregivers are often forgotten as part of this team. Yeah, right. And so I really try to make an effort when I'm seeing patients, after I'm done talking with them, to shift a bit to that caregiver and ask how they're doing. And almost always I'm met with tears, because no one usually asks that question. How can we help support you? But the caregiver is a huge part of the equation. And I think that's something that we're just starting to delve into as to developing those resources to how we best to support them. I don't have a specific book recommendation, but I think in preparation for this presentation today, my eyes were open to like so much that, ABTA offers for caregivers, again, whether those are workshops or mentor support or support groups. And then also the American Cancer Society has some really excellent, resources that I would recommend that you tap into.
Great, thank you. And thank you for sharing about ABTA. We do have a caregiver resource center on our website, as well as a caregiver book. And those two resources will definitely be in the documents sent post-event. All right, the next question we have here, and I feel like both of you can kind of answer this, is how to manage scan anxiety and fear of that next MRI.
Do you want to start that, Jakarta, or do you want me to?
Medication for me. I mean, I'm not ashamed at all. But I definitely, because my anxiety, it did heighten so much. I definitely had to get something to to help me, kind of navigate through all of those tests, MRIs, and a lot of the scans. So, but yeah, and it's, whoever asked that question, please don't have any shame at all about, asking for medication, to help you, and use a lot of prayer. That would definitely help you as well too.
Yeah, I think acknowledging that scan anxiety is real. I feel like so
Yeah,
many
it
folks
is.
that like I care
It
for
is.
like live in those like 3-month chunks, right? Like they get the news that their disease is stable or decreased, and they're good for a period of a few months, and then that next scan comes up and it like sets them all back
Right.
because again they're sitting in this period of uncertainty. And so again, I
Exactly.
think finding that strategy that works for you, whether that's like therapy, deep breathing, some of those mindfulness exercises, medications. And also like acknowledging like some of this is outside of your control. And that's like so
Right.
hard for so many of the type A
Yeah.
patients that I care for.
Yeah, that's true.
Thank you. And actually, a follow-up question we hear is somebody who's a healthcare professional. They're asking, how do I directly support my patients and their families when they're in that waiting stage of the next scan? Any suggestions, Betsy?
How to support them when they're in the waiting stage. So gosh, I think just, being that, compassionate presence and that listening ear, and again, acknowledging that those feelings that they're having are real and normal. I think, maybe as you just shared with the group, Jakarta too, is like, I think a lot of people feel like isolated in this and like, and what I'm feeling, is that like normal or am
Right.
I off here?
Right.
And so
Right.
I think just hearing that from you as a healthcare professional, that, these feelings you're experiencing are ones that, lots of folks go through.
Right. Yeah. Because waiting on results, that it just seems like it takes so long to get those answers. But that can definitely increase anxiety too, just waiting around on results. But just having, if you have that relationship again with your doctors, they can kind of help ease that.
And I think in this, new era of like open notes where patients often get the results of their scans before they meet with their healthcare team,
Mhm.
I think that could be good and bad, right? I think it's dependent on the person. Like, are they ones that like want to like do that preliminary read before they talk with their healthcare team, or do they want the healthcare team to like look at that and put it in perspective with their, eye of expertise on it? So I think again, as a healthcare professional, again, sort of talking with your patient and recognizing or asking like their preferences for that.
Mhm.
Thank you. Thank you both so much. The next question we have here is, how do I not lose my identity through this diagnosis, whether it being the primary cancer or the brain metastases?
I would just say, just know who you are. Know who you are. Cancer is a word, not a sentence. It's a word, not a sentence. So just be confident in who you are, and know who you are before this diagnosis, and definitely, while you're going through this diagnosis, definitely just know the person that you are.
Yeah, I think like Jakarta shared, like I think it's part of you, but it does not have to identify you, right?
Absolutely not at
And
all.
so again, maybe it's writing down in a journal like what makes you you, what makes you happy, and like always having that to refer back to when times are hard.
Thank you. And then, oh man, we have so many great questions coming in. So another person is asking, they were curious specifically for you, Jakarta, or maybe Betsy, with your experience working with patients, a specific diet that helped. I want to point this person who asked this question. We also discussed diet a bit on both days of our 3-day series. So feel free to watch the recording if you missed those days. But anything specific, Jakarta, that you could share that helped you, or Betsy, what you have found helped your patients?
Well, that's really funny because Betsy kind of knows she's always in the middle of this between Eric and myself because Eric is more on the plant-based, the vegan diet or vegan, eating, and I really don't like that type of those type of foods, but I think for me, what I try to watch is my sugar intake. I try to watch that, definitely. But I don't really do, I kind of try to eat. I do eat meat. I don't, I don't not eat meat, but I do eat meat. So try to increase my fruits and vegetables and just watch the sugar.
Yeah, and I think the advice that I give to my patients, again, is just eating a well-balanced diet, high protein, high calorie, high fat. Oftentimes folks are undergoing cancer treatment, lose weight. And when they lose weight, they become more tired and it's harder to tolerate the treatment. So again, really focusing on those things. And oftentimes, your institution will have a registered dietitian as part of that care team. So if there are specific questions or dietary preferences, I think tapping into them to kind of personalize, your diet.
Great. Thank you so much. The next question we have here is, this is from somebody who I think you might know, Jakarta, but they put anonymous in their question, but they've known you for 45 years. So it seems like a lifelong friend or family member, but they're asking, what advice can you share with people or some words of encouragement for anyone who has a certain family history of illnesses?
Definitely, if you have a family history, just make sure that you're having regular doctor appointments. You're keeping yourself checked. Don't be afraid to go to the doctor. It's extremely important with family history that you are seeing your doctor, on a regular basis, that you are keeping up with, all of the required testing mammograms that you're supposed to have. That's really, really important. So family history is definitely important. So you definitely want to keep yourself checked.
And
Yeah,
anything like encouraging just for like maybe their mental health about it all as well?
Mental health.
Yeah,
What was that again?
some words of encouragement for their mental health, as knowing like their family has a history of certain illness and maybe they're afraid that they might get it because it's in their family history.
Oh, okay, I got you. Just as I've said before, find out what works for you. If you have to talk to someone, if you have to, talk to someone about the anxiety that you may be having, or being afraid or being scared, talking to someone is okay. If you have to talk to someone to get through the anxiety and and mental health, do something as far as, to help relax you, whether it be, taking walks, take a lot of deep breaths, pray a lot, cry. But just don't be afraid to do nothing. Definitely. Don't allow fear to paralyze you.
Great, thank you. Anything you wanted to add, Betsy?
I just, knowledge is power, right? You're your own best advocate. Like ask those questions. Be prepared for those visits and making sure that you maximize your time with that, expert in the field. And as Jakarta shared, like get your screenings. and
Yes.
provide some good strategies too on how to help with that mental health piece.
Great, thank you. Next question we have here is, Jakarta, how can your friends and family best support you? How do you ask for help?
Just allow me to be myself and to be, to also understand that this is not easy. This is life changing. So, just allow me just to, just to be open and honest and, just accept, that it's a lot, that this is real, right? This is real. This is life. And it's real. And, the fact that I'm able to, to talk about, my feelings and my emotions. I mean, that's a good thing. So, but just basically just making me feel accepted and not making me feel like I'm a burden. Um, that's that's helpful as well.
Thank you. Any advice from you, Betsy, of how you can encourage patients to ask for help?
I think, folks, I've, in my experience, independence and function are super important. And so again, I think, maintaining, control of what the things that you can do for yourself, I think that's really important for your physical and mental well-being.
Right.
Acknowledging again that
Mhm.
things probably have changed. So if there's some things that are harder and you want to focus your energy on those things that bring you joy or that you are able to do, I think task your friends and family with some
Right.
of those things. And again, maybe it's running to the
Right.
grocery store or, cleaning up your house. So people usually want to help, but oftentimes they don't know how. So I think if you give them specific
Right.
tasks, that's a win for both parties.
You have to ask. You got to ask for help. My family tells me all the time, I can't read your mind. I mean, I need to know what you need. So just don't be afraid to ask for help. It doesn't make you any less if if you need help. Because I mean, even I know with me, I mean, I need help, with things from time to time, be it cleaning my house, be it folding clothes. I mean, because I have different challenges that, that kind of get in the way sometimes that don't allow me to do things as, the way that I used to. So, but asking for help is very, very important.
Great, thank you. Well, any last final words as we wrap up the Q&A?
I'm just thankful that I had the opportunity to, participate in this. This was another win for me, and I'm grateful to God for that. So
I would say the same. Like, I love being part of this, and I appreciate that you recognize the importance of the patient voice, right? Like, as
mhm.
professionals, we can share, our experience taking care of folks living with brain metastasis, but hearing from a person who's lived it and is living it, I think is so powerful and meaningful. So I appreciate you recognize the importance of that. And thank you, Jakarta, for being willing to be vulnerable and share your story.
Thank you for asking me. I appreciate that.
Yeah, I just want to thank you both so much. And there were so many comments in this Q&A, so I'm going to actually personally send them to you, Jakarta. You have a huge fan base here. Somebody called you a hero. I love that term, that you're such an
Awesome.
inspiration. So I'm going to send you all of this to look at on a rainy day. If you're ever feeling down, you have a great support system around
Oh,
you.
thank you. All
All
right.
right.
Thank you so
Well, thank
much.
you both so much for your time. I really appreciate it. And I hope this isn't the last time that we'll see you both. But I just wanted to say thank you for being willing to share your story, Jakarta. And thank you so much, Betsy, for being willing to share your insight and expertise.
Awesome. Thank you.
All right. Thank
I just
you.
Of course. I do see a lot of questions in here about the recording. You all will get a copy of the recording post-event. So don't you worry, since you're registered, you'll get it through email and then you can refer to these resources afterwards. Additionally, you will also get access to our resource document, which will include all the important resources that Betsy mentioned today, as well with our other speakers the last 2 days, what they mentioned. If you were not able to get all of your questions answered over the last 3 days, please join us next week with our day 1 and day 2 speakers, Dr. Iser and Dr. Piccioni, for a week-long Ask the Expert on ABTA's online support community. Scan the QR code to start sharing your questions, or you can go to abtainspire.com. Get your questions answered Monday, April 14th through Friday, April 18th. Additionally, we encourage you to take a few minutes to complete our meeting survey by scanning the QR code on your smartphone or going to the link bit.ly/AprilPFM. Probably would be a little bit easier to use it with your phone, so just go to the camera section, highlight it over the QR code. Additionally, you will also receive this survey link in your email, which will be sent out in a few moments. Your feedback is truly important for us to plan future programs. We love to hear what you all have to say. And the next few days, you will also receive the recording, as I mentioned, so feel free to be on the lookout for that recording and the resource document. A special thank you to all of our 3 speakers the last 3 days for sharing all of their insight and expertise. And just thank you all for joining us today as attendees. We really hope that this meeting was an opportunity for you all to feel a part of the Brain Mets community. Additionally, thank you to our Brain Tumor Collaborative partners for their partnership and support in putting together this meeting. Additionally, thank you to ABTA's sponsor, Accuray, for their support of this meeting. For more information about ABTA's programs, services, events, feel free to connect with us on our social media. Visit us on our website at abta.org, or you can email us at info@abta.org or call us on our care line, 1-800-886-2282. This now concludes our Brain Metastases Patient and Family Meeting series. Have a wonderful day, and we hope to see you next time. Thank you.
Thank you.